Welcome to NCSS Here for You. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously and strive to provide the highest quality services. According to Eric Erickson, a noted developmental psychologist, every person must pass through a series of 8 interrelated stages over the entire life cycle. NCSS provides a continuum of services to meet the needs of individuals who at any point seek assistance. NCSS's purpose is creating a stronger community, one person at a time. Now, let's get to today's show.
I'm Joe Helko, Director of Community Relations for Northwestern Counseling and Support Services, and welcome to another episode of NCSS Here for You. Each month on this program, we discuss a human services topic, and we do that with staff from one of our 3 service divisions. Our 3 service divisions are Behavioral Health Services, Children, Youth, and Family Services, and Developmental Services. And on occasion, we have guests from organizations that NCSS collaborates with throughout the year. This month's episode is titled Building Resilient Communities. Healthcare reform is sometimes viewed as the responsibility of policymakers and medical professionals. However, in order to effectively impact and improve the health of our community, healthcare reform must be a collective initiative and practice embedded within the field of healthcare, human services, and education. Childhood experiences, both positive and negative, have a tremendous impact on the future of violence, victimization, lifelong health, and opportunity, making these experiences a public health issue. How does NCSS fit into the equation of building a resilient community? Where are the connections being made? Who do we partner with? And how are results being measured? To discuss the importance of early childhood and adverse childhood experiences and building a resilient community in greater detail, I'm pleased to introduce this month's guests. Danielle Lindley Mitchell, Director of Children, Youth, and Families, Samantha Thomas, Integration Project Manager, and Amy Johnson, Parent-Child Center Manager. I'd like to welcome all of you to the program. So what are some of the common misconceptions about programming?
Well, I think when you hear about NCSS, people go to the common misconception around what is behavioral health or mental health and assume that what we do is solely around mental health treatment and that we're chasing symptoms. While some of those symptoms might be what have brought you to the door of NCSS, we provide care in an array of opportunities, and some of that may be from really shifting our work from prevention to wellness, from an individual level to a family level. And we're really looking at populations of people. That work, I think a lot of people are assume that work is happening in the office. A lot of the work around outpatient and psychiatry, that's where the work is occurring. However, we have a lot of folks that are working actually directly in the community, embedded in primary care, embedded in law enforcement, embedded in schools, and that are working with families one-on-one in their homes because that's where services will best suit their need. And so I think just getting a basic understanding that we're not, while you might have a diagnosis and there might be a few symptoms, we're really moving as a system of care, moving upstream and looking at prevention and working with the family in a holistic way that looks at from your physical health to your mental health and your overall well-being. That's really where our work is shifting, and that can happen wherever really the family needs those needs to be met. And so that can be in the home, community, and in the primary care, wherever. And so an array of services, an array of settings that we're able to provide programs and services for families.
Well, and I think the other important thing there too, Danielle, is the fact that this isn't new. It isn't as if we flicked the light switch a day ago or a month ago. I mean, this has been going on for years as far as being embedded in really like a fabric of the community.
Absolutely. I mean, when you think about the DA system, I believe the first designation was around 1965 with Northeast Kingdom, and that was designated to provide services for families out in the community and the home. And so as that process has evolved, we've expanded our services into different regions. We have our parent-child centers that have been around in existence since, I believe, 1985. So you're absolutely right. This is not new. What the service provision and what the needs of families have been have evolved and changed. And so
Sure.
our programs and services to meet those needs.
Sure. And that gets back to this whole continuum where I know a lot of people, as you said, are thinking that we're maybe strictly dealing with, say, adolescents and adults, and really don't have a sense for the fact we're talking even before birth.
Oh, absolutely. We have some great programs that work with women as soon as they've identified that they're pregnant, that we can go in and start doing some interventions with them and the family to support healthy development, parent education. So our services start there and work well into, elder services and care for families. And so you're absolutely right. It's the wide range of age across the lifespan. So, and I think it's really important for people to know because there are some assumptions around, when you talk about children that it might be just an adolescent or it might be a 5-year-old, and with adult services that it might be a 23-year-old, but it's really a lot across the lifespan.
Sure. Now, would you define resiliency and provide some examples of really what that's all about?
Certainly. So most people, most folks out there describe resiliency as a process, an adaptive process of basically adapting well in the face of adversity, maybe some traumatic stress, some upsetting events, right? So in simplistic terms, if you get knocked down, you get back up again. I think what's important to recognize now, and what more folks are recognizing now, is that it's not necessarily just at an individual level, right? So, excuse me, it might not be just that I got knocked down and I picked myself back up again. It might be that somebody in my community, somebody close to me, a relationship that I have, that they extended a hand and that they helped me to get back up again. So I think that that's a really important piece because resiliency is key, and we're talking about resiliency at NCSS, we're talking about resiliency in our community, we're talking about resiliency at the state and on national levels as well. And it's important to understand that when we're talking about building resiliency, we're talking about building resiliency not only in an individual, but in a community, because it's really important for that individual to have access to resources in their community to be able to pick themselves back up, or to be comfortable and feel safe accepting that extended hand, so that somebody can help them get back up. And so we do a lot of work at NCSS to build resiliency. Excuse me. Some folks say that it's about one caring adult. There's one gentleman out there who talks about a kid having one friend, how important it is for a youth to have a friend and to be able to identify that. There's a gentleman in Canada who came to Vermont to speak, I think a year or two ago. His name is Michael Unger, and he's done a lot of work within the United States, in Canada, and internationally, looking at resilience and what does it take to build resilience. And so he actually did some really interesting research where I think in our last show we really talked about adverse childhood experiences and how that can impact an individual over the lifespan. So he did some research on individuals who have these high ACE scores, right? That are doing really, really well, that are thriving in their communities, that are successful, that are happy. And so he identified 9 things that kids need to build resilience and to be resilient. So he talks about structure. It's really important for kids to have structure around them. They need to know what boundaries are. They need to have consequences. They need to understand why they're behaving the way that they're behaving, but we need to let them know that they have consequences. He talks about lots and lots of strong relationships, so not just maybe that one caring adult, but as many positive relationships as possible. So those are just a couple of those 9 things. But it's really important for us to maintain a focus on resilience so we can support individuals in our community to live in the face of adversity and to thrive and to be happy and healthy.
And the one thing we do know is that whether it's with an individual or a community, there's going to be adverse scenarios that play out, and it's how do you pick yourself up and recover from that. So in building resilient communities, what are we doing at NCSS from a children, youth, and family lens perspective?
Sure. So first, as an agency-wide perspective, we have taken on the activity over the last 4 years of trying to reach this goal of being trauma-informed. So we were in a really competitive process to work with the National Council to be a site where we would offer the opportunity to be part of a learning collaborative. And so we've been able to look at what does it mean to be trauma-informed as an agency, as a system, and not just about the services that we're providing in our offices and out in the community, those folks that are providing our one-on-one direct support, but everybody, our custodial staff, our buildings staff, our receptionists, everybody is important and a member of our family, and so it's really important for us to make sure that we're educating all of our staff on these principles and making efforts and making changes to our facilities, to our policies. We've looked at some of our policies to say, is this the most trauma-informed it can be? Is this really respectful of an individual walking through our door, looking for services and supports from us, who's come from a past of having some traumatic events?
And there's also the scope of services that we provide that play into that as well.
Yes, as we said earlier, I think our community has evolved, the needs of families have evolved, so our programs and what we do as an organization have evolved. When we look at around the settings that we have provide services, as I said, we're now integrated into off-sites such as law enforcement and primary care, because we know that's where families will access services. We're looking at how can we provide more consultation and training. And one of our best trainings that we provide is mental health first aid and youth mental health first aid, to really look at, as a community, how can we work at reducing stigma and helping understand that, yes, there are adverse childhood experiences, everyone will have them, and part of that is how do we support the individual and their family as a collective community and take responsibility for that. We're looking at, as I said, looking at prevention and wellness, so we continue to look at how can we gain funding mechanisms to move upstream. We're looking at wellness coaches and embedding those in some of our practice sites so that we can really be innovators and leaders in looking at how we integrate physical health and mental health, knowing that those can't work in isolation of each other and that they really do impact each other, and in the grand scheme of things produce more efficient and helpful outcomes for families in our community. We look at school culture, where we have a program that's called Positive Behavior Interventions and Supports, and that's really versus working with an individual student, that's really working with the school and identifying what are some culture changes that you want to look at behaviors of your students and your staff that will promote positive behavior. And so I think these are an array of opportunities that we're really looking at. And so it's not so individual focused, but here's the population and what do we want as a region for Franklin and Grand Isle? What is important to us? And looking at those collectively and working in partner with our community partners and stakeholders to say, let's be innovative and figure out what we can do different in some of this work. Again, we're still in homes. We continue to expand that. Our access numbers are through the roof right now. And our hours of care continue to increase around that with the care coordination that we're providing for families. That's something that we've been doing for a long time, and that practice continues to evolve as families' needs evolve. So I think we're just, the nice thing that I think as an organization, we're really looking at outcomes and using that to drive some of our programmatic decisions in our role within the community.
And speaking of outcomes, is NCSS actually in the state of Vermont is one of the organizations that's really been utilizing RBA, I believe, the longest, or at least in the DA system I know.
I think 16 years.
We've been doing 16 years or so. So I guess the reason for bringing that up is because there's a lot of organizations now that are talking about results-based accountability, and rightfully so. But I think, like with anything, you have a process and you build on that, and it takes time. And NCSS over the years has learned to best formulate the RBA when you look at the individual. It all gets down to the individual and the families that we serve and what's going to be important for them to better their lives. And one of the things that I've noticed is that how that has shaped itself over the years from a standpoint of being what is really important in that person's life, and are they really better off for all the services that have been provided to them when you look at it in a post measure, as opposed to pre. Once we've been providing services for a period of time, that you can truly see, are they better off? And that really is the key.
That's key, and it's actually essential in looking at when we advocate as a community for resources in our community, because it's great to have good stories, but you need to have the data that indicates that the program is working and it is meeting and shifting the needs and the overall well-being of the individuals that we're serving.
And when we talk about those that we serve, NCSS, unlike other designated agencies in the state, is very fortunate that we also have the Parent-Child Center as a part of our Family Center, which really gives us that ability to have seamless services for our smallest of small. So Amy, if you'd like to just talk a little bit about that and what it means.
I'm really excited to be able to talk about the Parent-Child Center and always having a platform to be able to educate people around the services that we do provide. I think when we started the conversation, we talked about common misconceptions, and I think one of the common misconceptions when we talk about the Parent-Child Center, either regionally or statewide, is that it's a child care center. And while many parent-child centers across the state do have a child care center embedded within them, we support early learning and early care opportunities in our region, but we have a whole host of other services that support children and families prenatal to 24. And so a lot of times when I say I work for the Parent-Child Center, people think, oh, you run a child care center, and that's not the case, though we do support providers in the region. I think what's really exciting about the work of the Parent-Child Center is that we have these 8 core services, and we have many programs where we're delivering opportunities for children and families prenatal to 24. We're doing parent education, parent support groups, we're doing play groups. We have a volunteer liaison network across the entire region offering play groups and opportunities to really support protective factors in families. We have information and referral. We have food programs, we have home visiting, and I think that's a really big piece, again, is that we have around 40 staff, and a majority of our staff do home visits. They're out in the community, they're meeting people where they're at, and the programming and our core services are deeply rooted in a foundation of strengthening families' protective factors. And we know that to decrease child abuse and neglect, to build resiliency, we need to be building protective factors in families, and I think that all of our core services are doing that. We have highly trained staff who are well versed in ACEs, who are well versed in building resiliency, and they're out in the communities, they're out in the homes, they're meeting families where they need them, and they're helping to build those protective factors, to build the resiliency in families.
So, hey, just one thing to add. I think one thing that's really incredible about the work of the Parent-Child Center, and that we're so fortunate, is that is a primary prevention strategy that has been around for a few decades now. And so the evidence behind it, it's been legislatively slated because of the importance and the outcomes that have been behind that work. And so when you talk about primary prevention, we're really fortunate to have that work embedded not only in our agency, but in our organization, also in our community. In our community
too, yes, absolutely. And just touch on maybe some other models of care that we're also utilizing as well.
Amy mentioned strengthening families.
Yep.
That's a key part of PCC. And building those protective factors is a key element of all of the services that we provide in CYF. But a couple of other models of care that we provide, many are evidence-based or promising evidence-based practices. So basically that means that there's been some research to show that it's effective and it works and it helps kids and families. We use the attachment regulation and competency model. We offer child and family traumatic stress intervention. We just started offering child-parent psychotherapy. We're doing
our parent-child interactional therapy model.
And I think what's important with one of the things you said, Samantha, is that evidence-based, so that the viewer knows that it's not like you just throw something against the wall and see is it going to be effective or is it going to work. That it's actually been based in research that yes, this indeed is a path that makes sense. you know what I'm getting at. I think that's important, because I think in some instances there may be an organization that is providing services, but it may not be evidence-based services, and if asked, about the research behind it, wouldn't be able to attach any kind of data or outcomes to it. So let's take a look at the effectiveness of this work when we're collaborating with partners at the local level.
So what's been really exciting lately is that Mary Pickner from the Department of Health and I, we had this opportunity to join the Building Flourishing Communities movement, if you will.
Yeah.
Really, I feel like it's a movement. So it's an effort across our state to bring information to the people. So we're bringing information about NEAR sciences, and that's an acronym that stands for neuroscience, epigenetics, ACEs, and resilience. And so basically it's giving folks in communities information that they don't necessarily have already, or maybe have a little nugget of, building on that knowledge, so that they can say, as this woman Laura Porter, who's one of the influential folks in the NEAR sciences, says, get it to the people who are impacted, and they will invent wise actions. It's really important for us to trust our community, that getting this information to our community partners, to folks that are sometimes not typically at our tables, that it's important to get that information to them. So Mary and I had an opportunity to meet with Laura Porter and Rob Anda, who's one of the co-principal investigators of the ACEs study. And we just spent 2 days with them, which was pretty incredible. And got to hear Dr. Anda talk about how he and Dr. Filiti came up with the term adverse childhood experiences over a burger at McDonald's. And so that was really exciting, and we learned all of this information that we're now able to bring to our community, and we've had 2 speaking engagements, and actually have another one this evening, and a few others planned. So that's a really nice opportunity for us to partner, NCSS, our Department of Health,
Yes.
And our local communities. The talk that we're giving tonight is partnering with Promise Community up in Richford. So just making those connections and getting this information out there so
Sure.
folks know what we're talking about, and they can make some good decisions.
Yeah, that's terrific, and that's another part of this whole education piece that we're talking about. It kind of links with when Danielle was talking about mental health first aid and children mental health first aid, and then we've got this programming. There's just a lot of ways in which I know that we're trying to share information with community members to help them, during certain circumstances. So I think that's terrific.
Yeah, I think building from that, we've had a kind of a merge of a couple of different groups that have been meeting at a local level. We've had our Integrating Family Services core team, and we've had what's called our Regional Clinical Performance Council Pediatric and Women's Health subgroup. And we recently made a merge this past week and renamed our group to be called the Family Health and Wellness Partnership. And that was really an attempt to bring the human services sector and the medical kind of framework together to talk about, as a community, how can we look at physical health and mental health and create some collective impacts and use the work of our organizations to further develop program development at a community level. And so that was really exciting. That's something that we've talked about for a while, and I think will actually produce some really great outcomes and create new partnerships for our local community.
And I think that one of the things I'm really excited about is we've started in this region a child care action team. And when we talk about resiliency, we know that children having access to early care and learning opportunities from a young age is something that's incredibly vital. It closes the achievement gap. It's that ability in terms of resiliency to build those positive relationships that might not be happening somewhere else. And we know that in our region, we have a lot of closures with child care centers and registered homes. And so as a large group of partners from every sector, business, health, child care, mental health, pretty much across the board, we've come together and said, we need to figure this out. This is important to turn the curve for our community to really do that prevention and early intervention work. We need to make sure that children and families have access to these opportunities. And so we've started that action team here in this region, and that kind of was bred out of a conversation that happened at the Parent-Child Center. And another thing that, and Sam had mentioned Promise Communities.
Yes.
We're really fortunate in this region to have 3 Promise Community cohorts. And NCSS sits on the steering and planning committees or helps as a consultant on all 3. So we have Sheldon, Swanton, and St. Albans. And we also have Richford and we have Alburg. And again, it's a really diverse group of partners across all sectors who are coming together and saying, what is the changing landscape? What will support children and families? What do we need to help families to succeed and to be resilient? And we're really looking at those social determinants of health. It's really something that when we're looking at all these diverse partners, we're able to focus on food and economics and housing and transportation and social events and connections. And so as a group, we've come together and brought in community members to really have a bigger discussion about what do the communities need. And we've seen some really neat projects and initiatives come out of the Promise Communities.
Yeah, those are all terrific collaborations locally, which I think are going to have impact as we continue to move forward. Now, what's happening at the state level to address adverse childhood experiences and resiliency?
So one thing that is really exciting, I think, from a designated mental health perspective, the designated agency, is that we're really looking at our payment methods and really turning that into a value-based system. And so it's allowing for the flexibility of providers to provide the services to families of where they're at and what the needs are. And so that's allowed us to look at the social determinants of health in a different way. It's allowed us to look at ACEs and to build resiliency in a different way, instead of being focused so much on, here's one treatment plan goal that you need to look at and we need to measure the progress around that. This payment system has really allowed us to shift the work and be more flexible within meeting our community and family need. I think the second piece of that is really looking at some of the legislation and being really mindful in what are the bills that we're working with our legislators and our policymakers on. One huge piece around that has been around trauma and ACEs, and Sam's been pretty involved with that, and so I think it's a way that as a system of care we're moving in a unified way of ensuring that the pieces that we say that we value are also the pieces in the language that is embedded into our policy that we're embracing and supporting families with.
And I think what's been lovely about being an employee of NCSS is that they've supported me, Danielle, Amy, to have a voice at a state level to be able to represent the needs and what's going on in Franklin and Grand Isle counties. And I think that's been essential. Yep.
Yes, and I can say that, when you look at it from a statewide level, on a legislative level, that you've all done a terrific job in representing not just NCSS, but the topics that you're there to discuss and to try to get legislators to have a much better understanding and grounding in the importance of all of these various initiatives and why they're important. Because I think a lot of times, information that people see, they only get the headline and they think that they've got it. And the scenario is it's not the headline, it's all of the detail is where the real work is and what they need to understand and how we can bend the curve in certain areas. So I just want to say, I know from our perspective as an organization, you all do a terrific job in representing not only NCSS, but the community and within the state as well. And with that, it's hard to believe, but it seems we always come to this point every time that you're here. We never quite get through all the material, and there's reasons for that. Yeah. But our time is up this month. I want to thank my guests, Danielle Lindley Mitchell, Samantha Thomas, and Amy Johnson, for being on the show today and sharing their insights on the importance of early childhood and adverse childhood experiences and building a resilient community. Now, before we go, it's time for the NCSS Factoid of the Month. Over the years, stigma has always distanced the discussion of mental health from that of physical health. Many feel that mental health is completely separate from physical health. Of course, the brain, just like all other organs of the body, is complex, and conditions and behaviors of an individual are connected. With 1 in 5 people seeking mental health treatment during their lifetime, and 50% of mental health cases being by the age of 14, we need to begin talking about and addressing these conditions much sooner than in the past. During the holiday season, many people become increasingly anxious or depressed. For many, the symptoms pass away following the holiday seasons. But for others, they live with these conditions each day. In fact, the median age of onset for anxiety is age 11. If gone untreated, this can affect a person's ability to learn, movement into adult occupational roles, and the formation of key social relationships and health habits. Consequently, this is why it's important to ensure that a person is properly treated and supported instead of letting stigma be a barrier to a healthier life. NCSS is here for you with outpatient services to assist in someone's time of need. NCSS, you may not know us until you need us. I also want to thank you, the viewer, for being with us this month and spending time with us. You can learn more about NCSS and all of our programs and services by logging on to ncssinc.org. I'm Joe Halco, and I'll be back next month with another episode of NCSS Here for You.
This has been another episode of NCSS Here for You. We hope that you found today's discussion informative and educational. Since 1958, Northwestern Counseling and Support Services has been providing access to high-quality services which promote healthy living and emotional well-being to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. Thanks once again for tuning in this month. NCSS's purpose remains creating a stronger community, one person at a time.